Hello everybody. I did my collaboration project on the unit-based team meetings, and I am Samantha Navarro. So unit-based team meetings are abbreviated with UBT, and these are meetings that are held monthly. What we're going to talk about is a little bit of the overview about the members, the purpose, the reason why it was created, and how it was created. We're going to discuss a little bit about the development, what the initiation process was, what the vision originally was and is now in the future, how the structure and processes work, how it's implemented, and how it continues to maintain itself, what some practical and ethical challenges are, a little bit about the course concepts, and what the future has in store for UBT. So the titles and roles under the member section, there are quite a few different roles that are involved in this meeting. They have clerks, registered nurses, licensed vocational nurses, the clinic program manager, and also union representatives. The clinics that are involved include the San Bernardino service area, which are Redlands, San Bernardino. There's 3 different clinics in Fontana, also Montclair, Chino Grand, and Ontario. All of them are included within the San Bernardino service area. The High Desert is also included in the service area, but they do not often make the meeting because they are farther and they have to go through the Cajon Pass. But they are included and they try to get involved as often as they can. The people that I specifically interviewed for this project was Lupi Alicoris, and she is a clinical program manager. She is the manager for the Ontario clinic, but she's also the one that kind of like runs the meetings. And I also interviewed Richard Mendoza. He is a representative from a Fontana clinic, and he is a licensed vocational nurse, LVN. And I also interviewed a clerk. Her name is Yerhady Zamora, and she is also in a clinic in Fontana, and she is also a representative. So the purpose of this meeting is to collaborate and involve all of the different disciplines and have all of the input from each clinic. What they wanted to do is have everybody come together from each clinic and the different disciplines and kind of provide their own perspective on whatever particular issues they're handling for that meeting, and kind of wants them to be more involved instead of having it be sole direction from the management level. So each member has a different role. They are all different levels of professions, but they all work towards a parallel benefit. So they all work towards what the best patient care would be. The way it was created was by higher level management, and it was based off of safety. From the interviews that I conducted, a little bit of historical information. It started with labor partner and management, which is often called LMP. This began after all of these strikes they had in the 1980s, where they decided to create this LMP because the quality of care for patients was declining. After they created the LMP, it prompted a need to improve care, and upper management level or upper level management decided to create UBT. Going into a little bit about the development, we're going to talk about the initiation and vision, the structure and processes, and the implementation and continuation on this slide. Going a little deeper into the historical background for the initiation section, after the strikes of the 1980s, they decided to create these unions. The base of the unions was to improve patient care. So after the unions formed, they started separating into smaller sections. Then more recently, upper management decided to make UBT teams in order for them to directly work with the labor and partner management on quality of care. How this works is the labor would be the regular paid, hourly paid employees, like the nurses, the LVNs, the receptionists, the clerks, um, and therapists, all of them. The management would obviously be the supervisors, the managers, the ones that are on a salary pay, and the partnership is the collaboration between the two of them. They were finding it difficult to collaborate and communicate between the laborers and the management. So by creating this LMP and then chunking it into UBT meetings, they were able to kind of mediate the process a little bit and help it further improve the quality of care. So during these meetings, they talk about a variety of different topics. The most important, of course, is safety. So they really focus on workplace safety. They work on improving the work environment. They want to improve workflow overall. But all of this all together ties into what affects patient care. The vision that they have was and still is to improve patient care. That's their main 100% goal. Everything they do and work on here is to improve patient care. Even when they are working on making the workplace safe, for the employees, that in turn affects the patients as well. So this is needed not just in behavioral health, but throughout all of the hospital systems. So UBT is actually um, all of the different hospital systems that come together and work together separately. So the UBT team specifically that I was interviewing is the behavioral health section. So the goals of UBT is to better communicate between the management and the laborers and have a more safe and constructive way to discuss particular topics. Some of the structure and processes of this collaboration is it's made up of multiple different types of members from different roles from all of the clinics in the service area of San Bernardino. They are required to have two co-leads present at each meeting. So one from labor and one from management. Of course, these meetings actually get very huge because they have a lot of different laborers that are present and a little bit less management. But they are also required to have a sponsor, which is the technically considered management, but it's the director of behavioral health. Although the director doesn't actively participate, they are required to be at the monthly meeting. And this is kind of more as an information because when they have to discuss about funding and trying to get those types of things approved, that would have to go through the director of behavioral health. So he or she does need to be present. The quality of care is, well, going into part of the processes of it. The quality of care is monitored by tracking something called the TPI. So that stands for the Treatment Progress Indicator. It's this iPad program that is given to each patient every time they check in for individual therapy, and it does a variety of assessments. It does the PHQ-9, it does the GAD for the generalized anxiety disorder. It conducts safety assessments, but at the end, it also monitors self-reported care, quality of care directly from the patient at every appointment. So another process that you use is called the People Pulse. This is a survey that's given out to all of the employees once a year, and the employees are giving feedback on how they feel about their work. So this includes like if they believe they have been given the right tools, the right resources, and able to do their job correctly, how they feel about the safety of their environment, how happy they are with the management and their personal roles. So that is part of the processes that they use. For implementation and continuation, there are monthly meetings that are held to discuss current issues, go over any conflicts, go over and change goals, discuss if they're being met, if what changes and goals need to be done. They do that accordingly. The current goal that they're working on is to improve employee happiness, and they believe that will help patient care because it'll reduce the amount of call-offs, which would reduce the amount of clinics that are working short-staffed. So it'll help with patient times, waiting times in line, and such. So this is being implemented by using specific questions on the yearly People Pulse. And then after the meetings, the members go back to their home clinic and they have a discussion with their clinic on what was talked about in the meeting, and then they kind of open up for suggestions. So they want everyone to be involved. They want everyone to have a voice. So even if you're not a representative at that meeting, they still want you to be a part of it. A little bit about the practical and ethical challenges. So one of the largest practical challenges they had was a lack of participation. It was a very small group prior because you had to drive to one particular location. So some people had to drive pretty far to get to the meeting. Also, it was voluntary, so it wasn't paid. After going over this in the UBT meeting, they got it approved through the funding and through the sponsor to have the employees be reimbursed for gas, as well as being paid for their travel time and paid for the meeting time. There are also other conflicts on like what is best, quote, best for the patient, or what's, quote, best for the employees. And everybody had, a different perspective on what was best. But that's where the co-leads kind of serve as the mediators throughout the process, and they work on overcoming whatever obstacle they hit. As far as ethical dilemmas, I was not able to identify any by any of the three participants that I interviewed. Neither one of them stated that there were any current ethical dilemmas, nor did they see any being projected in the future. What one of the participants that I interviewed did say is this meeting is kind of more about discussing those ethical dilemmas. So if something has happened, in one of the clinics, or something is kind of being seen happening more often, they discuss it during these meetings and they work on, how to fix it, how to overcome it, what can be improved from it. So it's kind of more a discussion as opposed to causing any type of ethical dilemmas or anything like that. The course concepts, the most noticeable one that I noticed was when we were discussing about the partnership and the collaboration models. So what we learned is the partnership is more like a formal arrangement to work together between the agencies, and the collaboration is definitely more in-depth, and it includes multiple levels of the workers, which also includes the planning and the evaluation of services, which this clinic or this meeting definitely does. My own assessment is that this type of collaboration is the multi-agency collaboration, because each role stays strictly within their boundaries. Like the nurses, only stick within their scope of nursing, and the clerks, just stick in their role of what they do as a clerk or as a receptionist. So they stick pretty strict with their boundaries, but they all work together towards the same goal, which is improving patient care or the quality of patient care. So that's how I've been able to kind of connect the theory that we're learning with the practical reality of what this collaboration does and how they work. The future plan of UBT is to, they dream to work not just in the partnership with, the nursing staff, the management, and the clerical, but they also want to begin to include the doctors and the therapists, because they are vital roles. They play vital roles in the clinic, and they're not involved in these meetings. They have they have a different meeting that's called best practice. So it's kind of, they've been having difficulty having the doctors and the therapists doing the best practice, and then the clerical, the nursing staff, and the management doing the UBT. So their future plans and goals are to kind of bring them together and have everyone work together concurrently on what they need to work on. So the future improvement, they feel that by expanding it and being able to include, the UNAC, which is the therapists and doctors, and include the 7600 union, which are the receptionists and nursing staff, by expanding and including everybody, all of the roles, all of the professions within all of the clinics, it would really, really help serve everyone's best interests and improve the clinic overall. The takeaways that I have from this project is I think it was most interesting for me to grasp the concept of how many different collaborations and how many different things are going on within the different agencies at the same time. So it's kind of It's kind of mind-boggling to see how it affects the patients, not only the patients, but also the employees and vice versa, and not just on a micro level, but also on a macro level. I still don't see macro being, my thing to do, but I do, every quarter that we're working on this and working on macro and projects, I have more and more appreciation for the work that macro does and how it affects the micro aspect of it. So that's it. Thank you everybody for listening and have a great day.